Okay, the next section that we're going to be talking about is I'm going to discuss some goals. So, Guyana has made improvements with the life expectancy. It's gone up from 65 to 69 in the past 10 years, and the mortality ratio has gone from 260 per 100,000 deaths to 215 in 2010, and that was from 2005. The mortality rate has gone from 43 per 1,000 live births in 2002 to 31 in 2010, and the primary completion rate for females has gone from 75 in 2003 to 105 in 2005 to 85 in 2010. So it's had its ups and downs, and it's actually gone down a little bit since 2005. And so even though there's been progress, it still is something that needs to be worked on. So section 3, a solution that's going to help stop these problems. The health minister said that there's going to be measures taken that include going back to the basics, which using systems in the past that have worked, introducing 8 new doctors at the maternity ward of the Georgetown Public Hospital, and who will advance their expertise. They're going to work with seasoned health workers as well as contributing to better the quality of care with their new skills. There's going to be a theater dedicated to maternal surgeries at the hospital, introducing postgraduate program in obstetrics at the University of Guyana, and increasing awareness mostly among health workers to ensure that women get the best care that they can. The alarm program was implemented in Guyana through the collaborative efforts of the SOGC and the WHO. County Office for Guyana and the Ministry of Health yielded some outcomes, which included a multidisciplinary group of 384 health professionals, which were trained through a total of 10 AIP courses. They are putting medical professionals through more schooling, and so they have a better knowledge of what to do in emergency situations. And then for child mortality, they're working on climate change, and they're helping figure out what to do on the problem, and they're actually making specific steps on what they want to do to help with climate change and global warming. They are trying to lower deforestation and the overall emissions. They want to lower it and reduce it so that less children are being affected by it, and they are hopefully hiring their chances of survival at such a young age, and they want to help educate women so that they know that what to do to take care of their children and make sure that their kids are getting the right nutrients and everything. And then for women equality and how they're getting underpaid, they're looking into ways to put women into higher positions and being placed on party lists so that they can be in the same positions as men. For the regional impact, that's section 4, And I compared Guyana to Venezuela, and the maternal health rate, Guyana was 280 and Venezuela was 92. For child mortality, Guyana was 30, Venezuela was 18, and for gender equality, Guyana was 85 and Venezuela was 95. So Venezuela is doing better than Guyana, but they're still having problems as well, and I think that they would benefit if if the steps were made to solve these problems in Guyana, it would also help Venezuela. And I think all the surrounding countries, and even ones not surrounding them, would benefit from this, because even if their problems aren't as severe as Guyana, they're still having these problems, and these solutions are going to help them. And I think that it could help any country, really, if you're trying to give people better education and better health care. It's going to help everyone. For Section 5, the global impact, Norway has actually been working with Guyana in under the United Nations Framework Convention and on Climate Change, or the UNFCCC. And they are trying to make an agreement, and the governments have decided to pilot an incentive structure on the national scale, and Guyana and Norway are making a partnership to help climate change and to help lower deforestation, especially. And because they're for a global mechanism to be effective, it must have both reductions in deforestation and maintenance of low deforestation rates. They have to keep track of it. They have to continually be working on it and checking on it each month, and they're having a partnership to do that. And in the UK, the Department for International Development is part of the UK government that manages Britain's aid to poor countries and works to get rid of extreme poverty. And the UK is working to help Guyana with its poverty with this program and within this department. And it's working to reach the Millennial Development Goals and the international targets agreed by the UN to halve world poverty by 2015. And they're really working on that with Guyana and other developing countries. So by doing this, helping with poverty, they're going to help with all of the problems with maternal health, child mortality, gender equality. If they're getting out of poverty, they're going to have more opportunities for women. They're going to have better medicines to help the people. And so some specific actions that I think need to be made are that for maternal health, just try to get the number of deaths down to 8 per every 10,000 births, because that was their goal a while ago, and for a while they were getting really close, and then it went up, and so they really need to work on that. And to do this, they're going to need better education so they can have more experienced doctors. And I think a reasonable time frame would be 2017, because their original goal was 2015, and I just don't think that they're going to make it, since they said they haven't been improving it enough. And I think a couple extra years are going to help if they really, really work on it. For child mortality rate, I think developing countries must be given adequate and predictable economic incentives to protect their tropical forests, because they don't seem to have a desire to. They've increased instead of decreased deforestation. And they're going to need to help global warming and reduce CO2 emissions, which are causing health problems among children. And so I think this one's going to take a little longer, because they don't have any desire to do it so far. So 2019, I said. for that. And for equality, the Gender Equality Commission needs to slowly increase women's wages because they said they were going to do that and they hadn't yet. And the society needs to get used to it slowly because they clearly weren't ready for it at the time. And so I said 2017 for that as well. And they just need to do it at a slower rate, I guess, because people weren't willing to help with that. And they weren't willing to actually raise women's wages like they said they were going to. So they need to make sure that someone more professional or they need to replace the people in charge of that because they weren't doing it, and they need to actually get it done this time. And I think that's all I have for now. I just hope that things improve and that they actually work on it before it's too late.